There is nothing quite like a toothache to stop you in your tracks. It's a deep, throbbing pain. It can make it hard to eat. It can make it hard to sleep. It can make it hard to even think. It can feel overwhelming and isolating. But I want you to know something important. You are not helpless. You have power in this situation, right in your own home. You have access to simple, effective remedies. Remedies that can bring you comfort. These are secrets passed down through generations. Even dentists nod in approval. They provide temporary relief when you need it most. You can take control of your comfort. This is about empowerment. Know what to do when that first twinge strikes. Imagine walking into your kitchen and finding exactly what you need. You don't have to suffer while you wait for a dental appointment. You can take immediate action. These remedies are your first aid kit for your mouth. They are simple. They are natural. Let's begin this journey together. You can do this. So, what exactly is a toothache? It's your body's alarm system. It's a signal something is wrong inside your mouth. The pain comes from the pulp, the center of your tooth. This area is packed with sensitive nerves and blood vessels. When the pulp gets inflamed or irritated, it sends powerful pain signals. It's a cry for help you can't ignore. See the pain not as an enemy, but as a messenger about your oral health. The message is, investigate. Many people think a toothache equals a cavity. When decay eats through the outer layers, it exposes the inner pulp to bacteria. Food particles or temperature changes can trigger pain. Hot or cold foods can sting a damaged tooth. Other causes, a cracked tooth, an abscess or gum infection. It can be from grinding your teeth at night, bruxism, or from sinus pressure referring pain to upper teeth. Many possibilities. A professional diagnosis is the goal. Recognizing causes is the first step to lasting relief. Home remedies can soothe pain but can't fix the root cause. They can't fill a cavity, heal an infection, or mend a cracked tooth. Let's start with the simplest, most classic remedy of all. A saltwater rinse. This isn't just an old wives' tale. It is based on real science. Salt is a natural disinfectant. It creates an osmotic environment that draws out fluids and bacteria from inflamed tissues. Think of it as gently cleansing and soothing the area. It helps reduce swelling and wash away food particles lodged in a cavity or between your teeth. It is your go-to first response and is incredibly easy to prepare. Here's how you do it. Take a standard glass of warm water. You want it to be warm, not hot. Add about half a teaspoon of regular table salt. Stir until the salt dissolves. You now have a powerful natural antiseptic mouthwash ready to go. Take a good-sized sip of the solution, swish it gently for at least 30 seconds, focusing around the painful tooth. Let it wash over the gums and the tooth itself. After 30 seconds, spit the water out. Do not swallow it. You can repeat 2 or 3 times, especially after meals. It's gentle, cheap, and ingredients are in your kitchen cabinet. Now let's talk about how to use it correctly. Half a teaspoon in a full glass is the perfect ratio. This remedy is fantastic for temporary relief and creating a cleaner environment. But remember, it is temporary. It cleans the area but won't heal the source. Book a dentist if pain persists. Sometimes the simplest solutions are the most effective. A cold compress is a perfect example. When you have a toothache, especially with swelling, cold is your best friend. First, it constricts blood vessels and reduces swelling. Less swelling means less pressure on sensitive nerves. That means less pain for you. The second way is a natural anesthetic. The cold numbs nerve endings. It's like putting the pain on pause for a little while. Helpful when you need to get some sleep. The power to numb your pain is sitting right there in your freezer. So how do you make a proper cold compress? Wrap a handful of ice cubes in a thin towel or washcloth. If you don't have ice, a bag of frozen peas or corn molds to the face. Never apply ice directly to skin. Protect it with cloth to avoid damage. Apply to the outside of your cheek over the area of pain. Hold it for 15-20 minutes, then give your skin a 20-minute break. Repeat cycles throughout the day as needed. This on and off method reduces swelling without harming skin. Cold compress is excellent for trauma-related pain. It helps when swelling is the major symptom in an abscess. A simple, drug-free way to find comfort. Use it as needed to create windows of relief and rest. It's simple, effective, and immediate. Let's move into nature's pharmacy, where we find potent pain relievers. First up is garlic. For centuries, garlic has been used for medicinal properties. Crushing releases allicin, a compound with antibacterial and anti-inflammatory effects. Allicin can help fight bacteria that cause dental plaque and reduce swelling. Think of a garlic clove as a tiny powerhouse of healing. Take a single fresh clove of garlic and peel it. Crush it into a paste to activate allicin. Apply the paste to the outside of the tooth or chew gently if tolerated. It might sting at first, then the discomfort should subside into relief. Leave on for a few minutes, then rinse with warm water. Rinse thoroughly after use. Next, clove oil, one of the most famous toothache remedies. Dentists have used it as a temporary anesthetic. Clove oil contains eugenol, a powerful analgesic and antiseptic. A tiny drop on a cotton ball can provide targeted relief. Dilute with a carrier oil, olive or coconut, to avoid irritation. Gently dab the oil-soaked cotton to the aching tooth and surrounding gum. Avoid excess contact with tongue and healthy gums. Always patch test first. Numbing should kick in within minutes. Keep a small bottle in your kit for emergencies. Garlic and clove oil can be powerful temporary tools. Use carefully and consult a professional if unsure. They provide targeted, immediate relief while you plan next steps. Sometimes relief can be simple: a warm, comforting cup of tea. A tea bag can double as a soothing pouch for the cheek or gum. Peppermint tea contains menthol, a gentle, cooling, numbing agent. Sipping warm peppermint tea calms nerves and relaxes you. Don't throw the used tea bag away after brewing. Cool it slightly, or pop it in the freezer for a few minutes for a compress. Place the warm or cool tea bag directly against the aching tooth and gum. Peppermint releases gentle numbing exactly where you need it. The bag also acts as a comforting compress. Another powerful remedy: guava leaves. Less common but traditionally used and researched. Guava leaves are anti-inflammatory and antimicrobial. 2 ways to use guava leaves: chew or make a mouthwash. Method 1. Chew a tender leaf to release medicinal juices. The juices coat the aching tooth and gum. Method 2. Boil 4 or 5 leaves to make a mouthwash. Bring to a boil, then simmer and cool. Once cooled, add a pinch of salt and use as a rinse. Use as a healing rinse like a saltwater solution. Fresh guava leaves from a market make an effective tool. Flavonoids in the leaves reduce gum swelling. Simple rituals like these can ease pain and soothe nerves. Talk to your dentist before using remedies if pregnant, breastfeeding, or on medications. These gentle remedies can calm pain while you seek care. It is absolutely crucial to understand the role of these home remedies. They are your support system, here to provide comfort and reduce pain. They help manage symptoms in the short term. Think of them as first aid for your mouth. They can be effective while you wait for professional help. They can make the difference between a miserable night and a restful one. They are bridges to care, not replacements for it. Home remedies do not cure the underlying problem. A salt rinse cleans but cannot remove the source of infection. Clove oil can numb pain from a deep cavity, but it cannot fill that cavity. A cold compress reduces swelling but cannot fix a cracked tooth. These remedies address symptoms, not the cause. Cause requires diagnostic tools and skilled treatment. Always plan to see a dentist even if pain subsides. If your toothache is severe, throbbing, and persistent, don't wait. If pain lasts more than a day or two, make the call. Look for other symptoms like fever, swelling, or trouble breathing. Swelling in face or cheek is a major red flag. A pimple-like bump on your gum could be an abscess. These require urgent professional attention. Seeing your dentist can save your tooth and protect your health. Timely treatment prevents simple problems from becoming complex ones. If in doubt, call now. Don't delay. The best way to deal with a toothache is to never have one in the first place. Prevention is the most powerful medicine of all. It starts with your daily oral hygiene ritual. Brush twice a day. Make it non-negotiable. Use a soft bristled brush and fluoride toothpaste. Brush for a full 2 minutes each time. Reach every surface of every tooth, outside, inside, and chewing surfaces. This removes plaque and food debris before decay forms. Floss once a day. Your toothbrush can't reach tight spaces. Think of brushing and flossing as a team. One cleans open surfaces, the other cleans tight gaps. Together they are your best defense. Make flossing a habit. Check it off daily. Your diet plays a huge role. Limit sugary, starchy, and acidic foods. Brush or floss after these foods when possible. Choose fruits, vegetables, and dairy to support tooth health. Calcium-rich foods protect enamel. Crunchy produce helps clean teeth naturally. Visit your dentist for regular checkups, at least once a year, or as recommended. A hygienist removes tartar you can't remove at home. Professional exams catch small problems early. Regular visits are your best insurance against future toothaches. Team up with your dentist for lifelong oral health. Prevention is an investment. Protect your smile every day. You now hold the knowledge to face a toothache with confidence, not with fear, but with calm purpose. Immediate soothing relief is often within reach. Saltwater rinse, clove oil, cold compress, tea bags, your toolkit. Use gentle, effective actions to calm pain. This is a tremendous step toward comfort. Use them wisely. Test remedies carefully and patch test oils. They are your first line of defense, a bridge until professional care. A calming ritual can get you through the moment. Remember, temporary symptom relief, not a permanent cure. Seek dental care. Listen to your pain, schedule that appointment. A dental professional can diagnose the root cause and provide a lasting solution. Discipline. Brushing, flossing, healthy food choices prevents pain. Walk forward with hope. You are equipped and capable. Your path to a pain-free, confident smile starts now. You can do this. Book that dentist visit when you can. Keep your toolkit ready and use it thoughtfully. Salt water rinse, cold compress, clove oil, tea bag, guava leaves. Seek care. See your dentist if pain persists. You have fever, swelling, or trouble breathing. You are in the driver's seat of your health. Temporary symptom relief, not a cure. Consult a professional when needed. Subscribe for more practical health ideas.